Hi, I'm Dr. George Lockwood, and what I'd like to do today is to provide a brief overview of the outcome data on schema therapy. It's been tested in 3 randomized control trials to date, and in those studies it's been found to be more effective than treatment as usual, transference-focused psychotherapy, and client-centered psychotherapy. The most recent study focused on cluster C personality disorders, and the majority of those patients had a diagnosis of either avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder. Now, that study has not yet been accepted for publication, so I can't go into more of the details now, but I can talk some more about the 2 studies that were done on borderline personality disorder. What I'd like to also say before I do that is that the therapists who made up the treatment as usual group were made up primarily of psychodynamically oriented therapists or analytically oriented therapists, and had a lot of training and were very experienced. Now, in the study on borderline personality disorder, schema therapy was found to be twice as effective as treatment as usual, and as twice as effective as transference-focused psychotherapy. And it was also found to lead to full recovery in the majority of patients, and to lead to across-the-board decreases, clinically significant decreases in the full range of borderline personality disorder symptoms, as well as a broad range of related psychopathology in almost all the patients that went through the study. The schema therapy was also found to have significantly fewer dropouts than transference-focused psychotherapy and then treatment as usual, as well as in the cluster C personality. There were significantly fewer dropouts than in client-centered psychotherapy and the treatment as usual group there. Schema therapy was also found to be more cost-effective than these other 3 treatment approaches. And when we look at the brains of the patients who went through the borderline personality disorder study, one large-scale study there, we found that there were deep structural changes, and that there was a normalization of the emotional responsiveness and hypervigilance at the level of the amygdala and the hippocampus. There was a 4th study that took a look at what happened when we took therapists from the randomized control trial, and when they were conducting schema therapy in day-to-day practice, we found that there was no decrease in effectiveness. Another finding from the comparison between transference-focused psychotherapy and schema therapy in the treatment of borderline personality disorder was that in the schema therapy group, over time, the relationship between therapist and patient increased in quality, and that over time, the relationship between patient and therapist in the transference-focused psychotherapy group decreased. We also found that there was a significant positive correlation between the schema therapist's view of the relationship and their patient's view, and there was not a significant correlation in the transference-focused psychotherapy group. So if the schema therapist thought the relationship was going well, their patient was also likely to see it as going well. And in the transference-focused psychotherapy group, their therapist thought things were going well. We would not have an idea of what the patient thought about it based on that. Another finding was that there was a significant positive correlation between the quality of the relationship in the schema therapy group and treatment outcome. And there was not a significant correlation in the transference-focused psychotherapy group between the alliance and outcome. So taking this together with the lower dropout rate in schema therapy, what we find is that schema therapy that's focused on the limited reparenting. Also want to add that there is a finding that the schema therapists and the patients in that group attributed much of the effectiveness to schema therapy to limited reparenting. So if we add that to the other findings, it appears that schema therapy that is focused on a process of identifying core needs and helping a patient to meet core needs for things like connection and limit setting is something that patients readily adopt and are more readily get engaged in, and leads to stronger alliances between the patient and therapist, and that these strong alliances lead to superior outcomes. Another finding that came out of the Cluster C randomized control trial was about training in psychotherapy. And Dr. Arnold Arntz is going to be providing an invited keynote lecture to go into a lot more detail on this, but one of the highlights is that when therapists are trained by reading material on schema therapy, attending lectures, watching highly trained schema therapists conduct schema therapy in videotapes, they were much less effective than if they had all those things, but also had practice in role plays and schema therapy techniques along with feedback from expert schema therapists. So it looks like the procedural aspect of the learning and what I think of as the gut level and the heart level dimensions of the treatment are quite important in terms of the outcome. Another interesting finding is that the therapists in the treatment as usual group were much more confident than the therapists in the schema therapy group. And the schema therapists who had recently learned the approach and were applying it in the study were feeling shakier about it. And whereas the treatment as usual therapists were confident, were highly trained, and had a lot of experience, and yet were having significantly poorer outcomes than the less confident schema therapists. The studies in schema therapy are ongoing, and we have two large scale randomized control trials in process, and one on antisocial personality disorder, and another is on group schema therapy of borderline personality disorder. And group schema therapy is the most recent development in schema therapy formats, and the preliminary data on this approach is very promising, and it looks like it's as effective or at least effective as the individual schema therapy of borderline personality disorder. And we're also taking a look at the combination of these approaches and various ways of mixing individual and group schema therapy in the treatment process. So there'll be a lot more information on group schema therapy, on the Cluster C personality disorder trial, and a lot of other things on schema therapy at the upcoming World Congress to be held in New York City this year. So if you're interested in learning more about it, we'd love to have you join us there. And you can register online at the International Society of Schema Therapy website at isst-online.com. And if you're not able to join us but would like to get regular updates and information, we have a newsletter sign-up form, and you can enter your name and email address, and we'd be happy to keep you updated. So I'd like to thank you for taking the time to listen, and